Hello everyone. In this video, we are going to be talking about the sacrum and the ligaments that hold the pelvis together. So we are beginning with our textbook, page 282. There we are. I am not really super concerned that you know all the pieces or all the bony landmarks of the sacrum, but there are a few that we do need to talk about because we'll have muscle attachments or nerves and blood vessels going through certain areas, okay? So this is the sacrum, of course. Dun, 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 dun. This is an anterior view of the sacrum. It does have a curve to it, as you can see. From a transverse view here, it does have a posterior curve. A posterior curve of the spine is called a kyphotic curve. Okay, so the sacrum has a kyphotic curve. Now, if we talk about the landmarks of the sacrum, well, there aren't a whole lot on the anterior of the sacrum. You have these little ridges, you can see them. These are the transverse ridges. And honestly, those are what is left over from the fusion of the sacral vertebrae. When you are forming in utero, these are separate. Before you finish developing, these do fuse together. So the sacrum is really 5, 4, depends on who you are, 5 or 4 fused vertebrae, okay? So again, this is what's left over, these transverse ridges from that fusion. You also have sacral foramen, the holes here, right? A foramen is a hole that goes all the way through a bone, usually for blood vessels and nerves and things like that. So the sacral foramen are no different. You are going to have nerves and blood vessels moving through those. Okay, as far as landmarks really that I want you to know, the sacral foramen, I do want you to know those. And then these right here. Okay, these are actually sacral ridges. Okay, they are, let's see if we have a, you can kind of see them here, sort of. Okay, it's on the posterior surface of the sacrum, but they are what's left of the spinous processes from the vertebrae that were fused. So it looks like a little bit of the back of a dinosaur, I think. Okay. Sacral processes or sacral spinous processes. You have 1, 2, 3, maybe 4. Again, just depends on how many fused vertebrae you have. Not every body has 4 exactly. Some have 3, some have 5, just depends, okay? The other thing that I want you to know is this right here. This is the top of the sacrum, and this is going to articulate directly with the last lumbar vertebrae. So L5 is going to sit right here. And it fits very nicely on this lovely flat surface, okay? You also have 2 surfaces on either side of the sacrum. They have holes because it's plastic. There aren't holes really here. This is just so you can put the skeleton together. So ignore these holes do not exist. Anyway, this is an articular surface. So this is where one of your coxal bones is going to fit. Well, try to get it to fit together. There we go. Sort of. Just like that. These actually don't fit together very well, even though they come off the same set, but it's okay. So that'll fit together in there. You can see just like that. Okay. Ta-da! Articular surface. So this is the sacrum. This is the ilium, right? This part right here is the ilium. So this is the sacroiliac joint where these 2 come together. At the bottom of the sacrum, are three-ish, again, 3 or 4 fused vertebrae. This is your coccyx or your tailbone. You do have 2 little transverse processes coming off of the coccyx here, but that's about it. I don't need you to know all of the landmarks of the coccyx, just that the coccyx is the tailbone, and it is also fused vertebrae. Okay, now let's skip ahead to page 336. All right, I would like to show you the ligaments, some of the ligaments in this area. Because you have these large bones, right? These are pretty dense, pretty heavy. Trying to get these to stick together like that. They do fit together well, unlike the shoulder, but this is the core of your body. It is the dividing line between the upper half of you and the lower half of you, and it takes a lot of weight. So the entire upper half of the body is balanced here. So you have a lot of ligament holding this area together. In fact, you have ligaments going all different directions, just lashing these bones together. So I'm going to point out a few that we will actually talk about in this chapter, because sometimes you have muscles that attach to soft tissue structures. So in other words, you have muscles that maybe have an attachment on the iliolumbar ligament here. You do. As well as bone. Okay, so sometimes muscle attaches to soft tissue as well as bone. So this one right here is the iliolumbar ligament, which makes sense, right? This is the iliac crest. This is the lumbar spine. So you take one word, you drop the last letter, add an O, smash them together. This is the iliolumbar ligament. Okay, that's that one right there. You have the posterior sacroiliac ligament. This is the sacrum, of course. We're attaching directly to the ilium, sacroiliac ligament. And you can see that one's pretty large. And of course they are on both sides. There's so much ligament that you actually have to take some off to show other ligaments. Okay, so here's posterior sacroiliac ligament, very large, very dense, holds the whole joint together. You also have the sacrotuberous ligament right here. It goes from the sacrum to the ischial tuberosity right there. Okay, sacrotuberous. Now, interestingly, we will have a hamstring tendon that attaches directly to the ischial tuberosity and kind of becomes continuous with this sacrotuberous ligament. So we'll talk a little bit about that when we talk about the hamstrings, okay? But for now, I want you to know the sacrotuberous ligament. We also have a sacrospinous ligament. Goes from the sacrum to the ischial spine. So it has nothing to do with the actual spine, it's the ischial spine that we're talking about. And it goes straight across here, okay? The sacrospinous ligament. Now we have some anterior ligaments as well. Okay, so here's another view of the iliolumbar ligament. Here's the anterior sacroiliac ligament. Okay, so it looks different on both sides, but it's pretty extensive. There's another view of that sacrotuberous ligament, that's posterior, and then the sacrospinous ligament is anterior. Okay. I also want to point out here the pubic symphysis. Remember, that is not a ligament, that is a piece of cartilage. It's a very, very dense piece of cartilage. It's different than the cartilage that is in your ear and your nose, okay? It's just a different type. But that holds the two pubic bones together on the anterior. You also have the inguinal ligament. I did mention this. The inguinal ligament runs from the ASIS down to the pubic tubercle. It stretches all the way across. And when we palpate this in class, it's going to feel very much like a guitar string. It's hard to miss. It is superficial, so it's hard to see from this view, but this is sort of raised up, okay? We're looking from here to here. It's going to go like this. So there's all kinds of things that are going to be going deep to the inguinal ligament. And the inguinal ligament is pretty much exactly here. It is right where you make your fold. So if you palpate your ASIS right here, straight down and across where you make your fold, where the bend of you is going to be the inguinal ligament. Okay, I also want to draw your attention to the joint itself. In the hip joint or the coxal joint, remember this piece right here is called the acetabulum, right? And I mentioned that there's a little dip right on the inside here that holds a ligament. And there's also one right here on the head of the femur that holds a ligament. Incidentally, this little dip does have a name. It's called a fovea, F-O-V-E-A, fovea. That's just the name of a dip in a bone. As far as I know, this is the only one that we have. Anyway, remember I mentioned that the round ligament holds the head of the femur in the acetabulum, and they attach on these little dips, okay? So there is a cut right here of the round ligament. You see just part of it. You don't see the whole thing. Now you can look in your book, of course, this is the next page, but I just wanted to make that a little bigger. Okay, so that's the round ligament. Again, it's cut. You also have this right here. This is cartilage. Okay, you always have cartilage within a joint, always. Cartilage prevents grinding of bone on bone, which is bad. You don't want that. Okay. And then, of course, there are all kinds of ligaments that hold the head of the femur into the acetabulum. Okay, but right now we're talking more about the ligaments of the pelvis. Okay, so I do want to back up for just a second. Since we are going to be talking about the pelvis and the thigh, I mean, we're going to be talking about muscles of the pelvis, the gluteals, the adductors, for this particular lesson, it is worth noting that there is an endangerment area here, and these are the borders of it. You have the inguinal ligament, a muscle called adductor longus, which we are going to get to in this lesson, and a muscle called sartorius. It's this one here. Sartorius is the longest muscle in the body, by the way. Just a fun fact about sartorius. We're doing that one in the next unit. But anyway, you can see the triangle that is made with these three structures. So the inguinal ligament, adductor longus is going to be right about here. And then sartorius. It is a lovely isosceles triangle. Within this triangle, you have these green things, they're lymph nodes. You have this blood vessel right here, which is the femoral vein. You have this blood vessel right next to it, that's the femoral artery. And then you have the femoral nerve. So you have a vein, an artery, and a nerve all passing through this area here. That makes it an endangerment area. And this endangerment area is called the femoral triangle. As you can imagine, that is a pretty good description, okay? So the femoral triangle is an endangerment area. So when we're palpating these structures like the inguinal ligament and the adductors, we need to be very careful where we put our fingers. You will not be able to feel the vein, but you will be able to feel the artery because arteries have pulse. Okay, if you feel a pulse, get off of it, is my general rule. The femoral artery will give you a pulse. It is a very large artery. You should be able to feel it. Okay. You don't really have to worry about the lymph nodes necessarily, because unless they are inflamed, they will be small and rather deep. You can press on them and you won't hurt them. But we're not doing anything real deep in this area. That's sort of the point. You know, we're careful in this area. Okay, that's the femoral triangle. I wanted to point that out to you as well. Okay, so that's it for the sacrum and the ligaments that I want you to know of the pelvis. And the next lesson begins the muscles. We're going to start with the gluteals. See you soon.